As you can see, today's webinar topic is data management in public health procurement and supply chain. And this will be, this topic will be presented by Professor Andy. He's a faculty of Empower School of Health. So now we'll just move on to, and this will be a 1 hour session. The certificate will be sent to all. This is live on Facebook also. So if any of your colleague hasn't been available or couldn't be available at this time, so they can share the recording, which will be available on the Facebook live page. So there are a few housekeeping announcements for participants. You cannot unmute yourself, but if you would like to speak, you can just put your questions on the chat box once the presentation is completed, and that will be answered by Professor Andy. And if you have any further question, you can raise your hand and we will give you the rights to you to unmute yourself. You can, as I mentioned, you can use the chat box for your questions. Those will be acknowledged during the Q&A session. There are 2 polls, so I really would be appreciate your participation on the same. Webinar recording will be available in Empower School of Health YouTube channel. The slide deck will be shared with all participants. And as I mentioned, please participate in the poll. Now this is time to launch poll 1. I would request backend team to please launch it. And all the participants, please participate in this poll. So this is basically, we would like to know something about yourself. There are very brief information about yourself. And it will give us an idea from which background our audience are, what are their requirements, from which region they are, and how they got to know about this webinar. So this is basically a feedback poll. So your participation is really appreciated. So I can see, for today's webinar, I can see there are almost 200 participants who are available currently. So please participate. We'll wait for a few seconds and then we will move on to next slides. Thank you. I can see 56% of the attendees have participated in the poll. I would request others to please do so. So we can move on to other slides. We will wait for next 50 seconds more and then we will end this poll and move on to next slide. Thank you. Now I would request backend team to please stop the poll and show results to audience. So I'll just briefly explain you the results for poll 1. The maximum gender who have attended today's webinar, those are 68% male and 32% female. The maximum age group that we have today amongst audience, that is between 30 to 40. The maximum are from elsewhere. Okay, we need to just dig into it elsewhere. Okay, rest 17% from West Africa, 16% from Central Africa, and 11% from South Africa, and 1% from Sierra Leone. Okay, the maximum audience are from pharmacy diploma and bachelor's degree as per their academic background. Then work experience, I can see those are mix and match. So maximum 33% above 5 years of experience. The sector of working from where the audience are, that is 34% NGO and 32% private sector, rest from academia, state government and national government. The area of work maxima are from supply chain. So as you can see today, webinar is majorly focused on data management. So you can accordingly take a part on this. Then which type of organization do you work with? So that is 42% others. How did you hear about this webinar? From Empower email, that is 85%. Thank you for your participation. Now we will move on to next slide. Now I really would like to introduce Professor Andy for his presentation. Professor Andy, over to you. Thank you.
Greetings to everyone. Good morning, good afternoon, good evening, wherever you are, because here in Southeast Asia, it's evening time. Okay, let's go ahead with the next slide and we go straight into it, please. I think by now, looking at the names, most of you have been with Empower before and you're well used to my voice and know who I am. But basically, I am now the Emeritus Professor at the Empower School of Health. I'm one of the original authors of the Yellow Book, which was Managing Drug Supply by MSH and WHO, and also the USAID Managing Medicines. I've worked in more than 40 countries, and my main one is on new medicines and introducing new medicines for tropical diseases. Yes, we can go to the next slide, please. Point I want to make, because today we're going to talk about data analysis. And right now, data management, data analysis is all the rage. It's the big fashion. Everyone's talking about it. We must have it. But we've been talking about it for 2,000 years. In the logistics of the Roman army, in the papaya from ancient Egypt, from Cleopatra's time, 2,000 years ago, we're talking about data management for healthcare supplies. In the modern era, we first published Managing Drug Supply in 1982. So it's been a long time. And still, we're talking about data management because we don't really have it. I'm going to talk for about 30-40 minutes and then open to question and answers from around that. Please enter any questions you have as we go along in the chat box, and I'll try to get to them when we come to the Q&A session. We can go to the next slide, please. So why is data management so important now? Why is it the big fashion statement in supply chain now? Well, of course, the simple answer is COVID. COVID has highlighted the appalling state of our public sector healthcare supply chain. It was bad before. We knew it was bad. All the people working in it knew the problems, but somehow our administrators and our senior leaders didn't. And we have to now convey that message to them, that we were not resilient. We didn't have the data. We didn't know where things are. We didn't know what was expired. We didn't know how much we want. And we were just not ready and not prepared. For sure, another pandemic is going to come. And we have to be a lot better prepared for the next pandemic. We can't keep saying it's once in a lifetime. No, it isn't. They're coming more often now. That's part of global changes. Part of global climate change. It's part of global geography as people travel much more. We have to have much better data. We have to have much more resilient supply chains than we've had in the past. To be resilient, we have to know what is happening. And that means that we have data management. Next slide, please. So why now part 2? Well, because you have been asking for it. Every webinar we do, number one question we get on every webinar is data management. What about data? Well, there already are many courses on data management and data analytics, but none of them have been specific for public health supply chain, and none of them have been relevant for low and middle income countries. That's changing now. Empower is writing a course specifically for that, and that should be available shortly. But fundamentally now, why we're addressing it now is because you, the public health practitioners in the field doing the job, have asked for it. Next slide, please. This webinar is in conjunction with Sierra Leone. And if we look at the National Integrated Supply Chain Strategic Plan from Sierra Leone, we see data is mentioned 56 times. That's in their plan. Usually it mentions it saying we've got to do better. The data use is low for decision making. We don't have the quality of the data. We don't have standardized data. We don't have standardized lists. We don't even have a standard list of the facilities we've got. We don't have a standard list of products. All of that together. So there is a growing recognition of the need for data, of the need for much better data management. But that recognition is not yet being transformed into action on the ground. Next slide, please. But why do we need all this data? We've managed for 30 years without all this data. Surely we can just keep on managing, can't we? Well, if we look at the Lancet Commission recommendation, they said you should be spending $25 per person per capita, that's per year, on pharmaceuticals. If we look at Sierra Leone as our example, population around 8.4 million, that means we're going to be spending $200 million per year on medicines. Think now the population of your country. I see we've got quite a few people from Nigeria with a population of 200. What's your annual buy going to be? Billions. How can we keep buying medicines in millions of dollars on guesses? Because right now we're guessing. We don't have the data. We don't have the knowledge. We don't have the information to enable us to calculate correctly. We're guessing because we don't have data. All the time, it's best guesses. And they've carried us through, but they're not appropriate for millions of dollars. There is no one in the private sector who would operate millions of dollars worth of company and not have data and do it on guesses. Nobody would do that. Yet in the public sector, we do it every day. So what's the problem with the data? Well, it's not just white-haired old professors saying it's a problem. Here we see from the Partnership for Supply Chain Management, it is the supply chain's biggest challenge, number one problem for the public health supply chain is data. We don't have it. Sometimes we have it, but it's in silos. It's locked away. We can't get it. Procurement doesn't share the data with warehouse. Warehouse doesn't share the data with users. Users don't know what they want. It's all disconnected. Even when we have a bit of data, we're not linking it together. And that's affecting our supply chain. Our supply chain performance is poor, number one, because of the lack of data. And the pandemic, COVID, has highlighted all these cracks, all these deficiencies, and all these problems. And that's why we're looking at data more now. It's always been a problem, but COVID has highlighted it, has brought it to the fore. Next slide, please. So why don't we have data? Well, the number one problem is because we don't have data skills. We don't have core competence in data. We need personnel. We need people with an array of skills. Look what Global Fund has to say on the quotation here. These skills are not limited to software project management, subject matter expertise, business analysis, business processing, enterprise architect, a big list all about data. Talent crisis, we don't have people who can manage, who understand processing of data. And we're struggling to recruit and develop them. But my overall message to you is not to be despondent. Yes, it's a problem now. We are borderline dysfunctional. We're just scraping by on our supply chain systems. And for sure, lives are being lost because we're out of stock, because we don't know what we've got and where it is. And we're trying to use obsolete techniques, often post-colonial techniques. They weren't any good in colonial times, and they're certainly no use now. But we're stuck with these techniques. and we've got little reliable data to use with them. But my message is one of hope, is one of change. I believe even in this environment, even with all its problems, it's still possible to utilize supply chain data management and supply chain analytical methods to drive and force improvements if we advocate for improved data collection and if we introduce modern methods of data management. And that means you can make a difference by assisting in promoting and advocating the life-saving role of supply chain data management. My message is one of hope, is one of the future. We can do it because you're already aware of the problems on data. We now need to convert that awareness into advocacy and to action. Next slide, please. The problem we've got to start with is we don't have processes for capturing data. We're not collecting data. And that has to change. We have to start collecting data. We have to introduce the processes, the methodology to start capturing data. Then we have to recognize that often the data is locked. It's in paper. It's no use to us on paper. We can't process it. We can't work with it. What we have to do is unlock it. And that means having data processing, having data management, integrating data from multiple sources, complete, timely, and accurate data. That might sound like wishful thinking. We're locked into these paper systems. We've got some computers, but they're quite old-fashioned and they're not very good and they don't scan. We can work with them and improve them if we introduce processes and methodologies to start capturing data. Often the data is available, but we're not capturing it and we're not processing it. We need to change that situation, and that change requires awareness and advocacy. If anyone asks us what went wrong on COVID, data. We needed much better data. Next slide, please. As an example of the lack of data, during COVID, Empower did a survey of countries in Southeast Asia. And we looked at which countries have got data on basic supply chain parameters. What's your stock out rate? How many days were you out of stock of PPE? What's your expiry rate? What's your damaged goods rate? What's the value you've got of the stock in the warehouse? What does it cost you to hold stock in the warehouse? What's the delivery time? What's the transport time? What's the procurement value? And only a quarter of countries had even some of the information. Only a quarter. 75% of countries just did not know. That's in Southeast Asia. And what does that mean? We're taking decisions, millions of dollars decisions on the supply chain with no data. We're guessing because we haven't got any data. We haven't got any reliable information. Not just your country, 75% of low and middle income countries don't know their basic supply chain parameters because they're not collecting the data. Next slide, please. Well, how can you possibly undertake any supply chain management if there's no data? And there's really two approaches. One is to say, we've got no data, so we can't do anything. We've just got to guess. That's it. I don't accept that approach. I say it's possible to do data science without big data, without having a completely fully computerized automated system. We can still do data science. You don't need a whole warehouse full of data in order to be able to do data management and data analytics. There's lots of things we can do with little data. Just by taking what we've got and managing it, processing it, and analyzing it, we can have a big impact. And my message is we need to start doing that. That's the first step along the road to getting us to big data. Next slide, please. To do that, we need a multi-pronged approach. There's no one size fits all for any one country. We can start with little data just by doing some sample surveys, going to a few hospitals, going to a few clinics, seeing what the supply chain situation is, collecting the data from them. That's little data from surveys. We can use proxy data. If we don't know in our country, or perhaps a region of our country, we can use data from other countries, but have collected the data, or other regions that have collected the data. And we can use that proxy data to develop models and algorithms for data management and data analytics. We then have got to strengthen our systems, and we follow the theory of change. We've got to recognize the problem, we've got to instill the change, scale it, and sustain the change. That change is collecting data, managing data, analyzing data. And then to use technology to leapfrog. Can we use barcode scanning? It's not so old-fashioned. Many little shops have got barcode scanners. Surely we can use barcode scanners in the warehouse. Surely we can use them at bigger hospitals to control the stock levels. That's technology leapfrogging. Then I've got data captured immediately from the barcode. Everything about that product, where it is, what it is, expiry date, how much is there, all digital data collection automatically. So 3 prongs like a fork. Data using little data, strengthening, starting to collect data, and technology leapfrogging, all 3 together to move forward. Next slide, please. If we start with little data, that is, we just go and do surveys. We do a survey, we collect from perhaps just 10 hospitals or 10 clinics, and we look at the information there. What's the effect of expanding the workforce? If I have more staff, does it actually make a difference? Is it actually better? I can do that. These are all examples from Jos in Nigeria, where simple ones has gone forward. What's better, to buy bigger vehicles or to use smaller vehicles and deliver more often? Which is more cost efficient? Which is more cost effective? Well, if I don't have information about my vehicles, I'll never know. So I can go and collect the information and then see and then analyze. That's little data. Just going to a few hospitals, a few clinics, collecting. But it enables me to draw up a model, an algorithm, to predict the future, to start making informed decisions. It's not all that good. I really should have full data. How many vehicles have I got? What's their capacity? How many kilometers are they doing? What's their downtime? If I had all that information, I could plan my transport much better. But even with little data, I can start to plan a little bit. And that's an improvement. I'm no longer guessing. I've got information I can use. Next slide, please. Proxy data is using data from other countries. And I'm going to use the example of COVID. When COVID started, we had no data. We'd never had COVID before. We've got no historical consumption. How much PPE were you using for COVID? Well, don't know. We've never had it before. So we used proxy data. From the World Bank, we used population data. That was to do morbidity-based quantification. Imperial College London developed epidemiological models. How many cases are you going to get? That was proxy data. We didn't know how many cases. We did a survey and we developed an algorithm, a model. And then we put together algorithms for the supplies using the systems we collected during SARS and avian influenza. How many gowns do you need per patient? How many masks do you need per patient? How many ventilators do you need? It was all new. We didn't have COVID before, so we used proxy data. using the data from SARS and avian influenza. And then the WHO team helped to combine all of that together into the WHO COVID-19 Essential Supplies Forecasting Tool. Next slide, please. So when we started this tool, it wasn't all that good because we had proxy data. But the point is here, we started collecting data immediately. So that over time, during the COVID epidemic, it got better. Proxy data was the start. We had to use data from outside. We had to use data from the USA and from Europe, not really appropriate for our countries, but that's all we had. So we used that proxy data and started collecting data to feed in to this model. So over time, the model got better and better. How many masks? How many aprons? How many rubber boots do you need? How many gowns do you need? All of that went into the algorithms for forecasting what we need for COVID. Here's an example of using proxy data. And we can use proxy data in lots of areas. But the point is not just to have proxy data, to start with proxy data and then collect data to improve the models and the algorithms. The proxy data gets us started on the process of models and algorithms. Next slide, please. Some of you may have already used the WHO COVID-19 Essential Supplies Forecasting Tool, which had medicines list you can see on the left. It had the emergency supplies catalogue listing out the type of catheters that you needed for oxygen, lists of medical equipment, and then tracking and calculating how much you needed. How can we do those calculations without data? We used proxy data at the start. Data from SARS, from high-income countries, data from avian influenza, the two closest diseases to COVID, to forecast how much we need. And you can use proxy data in a similar way in your countries if you don't have data available. Point again is to start on proxy data, collect data, and then replace the proxy data with collected data. Next slide, please. But did this really work? Well, it didn't start off very good. The first iterations weren't that accurate on the forecasting, but they got better because we collected data all the time. So over time, from March through to January 21, it improved, it got better. The forecasting became a lot more accurate. We were able to send signals to the market, how much we needed, how many massive scale-ups of gowns and masks that were required. Because we'd got those models in place, developed from proxy data, but changed over time with real collected data, constantly revised and improved as real data became available. Next slide, please. So for this systematic strengthening, we go through a system called theory of change. Recognize the issue. I'm sure nearly everyone on this webinar already recognizes the issues around data. Then look at the solutions. We need to collect data, and that means that we've got the methodologies, the techniques, and the skills. We've got trained people, and that means you have the skills to collect, manage, analyze, interpret, and act on the data. All of these have to be in place. Buying a computer will not solve the problem. If you don't have the skills mixed to manage, analyze the data, the computers are useless. They can be helpful, but it needs number one, top of the list, skilled staff. Staff who understand and have the skills to manage, process, analyze, and use data. Actions: advocate. Push for this in your country. Recognize the role that data plays. Next slide, please. So to go through that, we start by instilling actions that support. Start collecting data. Then expand. We can only collect data from 4 or 5 hospitals. Okay, That's all we can do to start. That's the instill. But then we're going to scale up to go to the whole country and get data from the whole country. And then we're going to sustain those actions. In order for this to work, it means we've got trust. People trust the data is going to be used. Not that some poor nurse in a clinic is filling out 20 forms every day and never sees any supplies. That's not trust. We have to build trust that data reporting is going to be real and delivers results. You need the knowledge and skills to process, analyze data. Incentive and motivation. Yeah, people have got to be motivated to do all of this. We need the structures, the methodologies in place. Throw out these archaic colonial era mechanisms, bring in modern supply chain management. We need the resources. Yes, of course, we need money and the tools, but most of all, we need the human resources, the skills. That's you having the skills for data management. And of course, we need the policies to make all of this happen. Next slide, please. Leapfrogging, think about what we can do, mobile phones, barcodes, lots of systems available for leapfrogging. We don't have to keep using paper. Now we can do lots of things automatically. It's being aware. You do not have to become a computer expert. It's just being aware of what is available and how it can help. Next slide, please. COVID has forced many changes upon us, forced lots of activity, especially from the donors. One of them is this idea of the control tower, the single version of the truth, because often there was contradictory data and contradictory reports. Use that to our benefit. Use COVID, because it's highlighted the problem, as a lever, as a push. Look what happened in COVID. It's going to happen again if we don't get better. It's a route for advocacy, to try and make our leaders, our ministers, our permanent secretaries understand what is this going to do. Next slide, please. Well, did it really work? Does it really work properly? You're telling a really good story here, but does it actually work? Well, there are examples. Because this was a webinar with Sierra Leone, these examples are from Sierra Leone. They're on the screen there. Okay. Data quality assessments and the data quality assessment tool and the channel systems used. Yes, really does improve. It really does save lives. And that's a message we've not been good at communicating. Stop guessing, now move towards informed data, evidence-based systems. Next slide, please. Now, Empower is currently developing a new course for data management in public health, procurement and supply chain. It's a 12-month course, 10 modules, all the subjects on the modules here. Lots of different sections to look at on data. Quite intense 12-month online course. It's not ready yet. It will be released shortly. I'm sure you'll get the notification when it is released, but it's all aspects of data management. So collecting data, analyzing data, using data, data policy and governance, health information and data standards, very important for us. Sure, all of us have got computers that can't talk to each other because they use a different data standard. Next slide, please. Okay, so data management is a critical requirement. Lives are being lost. That's what makes it critical, because we can't operate as well as we want to because we don't have the data. Data's identified lots of reports about what a problem it is. And senior PMS, procurement supply chain management staff need data skills. Does not mean you become a computer expert. It means that you know how to manage data, how to analyze data, how to use data. Okay, I see I'm just on 40 minutes, so let's change now to Q&A perhaps. We have the next slide, or do we have a poll? Okay, Q&A session. Let's see what's in the box from the Q&A session. Chats 99. Hey, let's see. What method did you use to collect data during the COVID period? Okay, different countries, different techniques, but basically we used Excel spreadsheets because it was quick and easy. We used that to capture consumption, and we fed that back into the algorithms. So mainly it was interlinked Excel sheets in Excel workbooks. That was the technique that was used. How many gowns, how many masks, how many ventilators were actually being used? What strategy did you implement for rapid data collection and transmission from downstream to upstream? Okay, the key strategy was to use top up. So the hospital is given 100 gowns. When they are getting low, they order them again, and the next 100 gowns, and that goes like that. And that gives us the data flow on the data usage. So we used it on flow rather than trying to get hospitals, clinics to report because they were already overwhelmed. So we used it on supply chain flow, how often we issued to them in set numbers of lots. And that's how we got it. So we use the algorithms. You have got 50 patients. We think you need 4 gowns per patient per day. So that's how many we issue, 200 at a time. And then we count how many times we issue the 200 to you, to the hospital, and what the actual usage is. Okay, let's go a little bit more. A lot of people asking for the slide deck. Yes, it will be available on the Empower website. You get a recording from us. Okay. If there are any more questions, please type them in the box. How can we establish trust during data collection from the private sector? Number of points around dealing with the private sector. First is confidentiality. And that means that you understand the rules on data management of confidentiality. And surprisingly, most low and middle income countries have got rules, but supply chain staff don't know about them because data management is operated centrally and it's not communicated. So often there are rules. We establish trust by confidentiality on the data collected from patients and from private sector. How do we address behavioral issues around lack of data, such as not making data available for use? Okay, that's a difficult one. And basically, we do it by going to the top man. We say, we have to have this data available. And often it's a misunderstanding. Often they think we want disaggregated data. We don't. Most people are willing to part with aggregated data. That is bulk data, not detail. We don't need the detail. I don't need patient names. All I need to know is how many patients have you got? And once that's explained and properly communicated, often these silos, these barriers are broken down between sharing data. The main point around it is aggregated data. We do not need, and we do not want disaggregated data. I don't need patient information. All I need is how many patients. I'm not interested in their names or gender or age. All I need is how many patients. And that type of aggregated data is normally available. In low-income countries, the main problem is internet and phone network. No, it isn't. No, it isn't. If you can use a mobile phone, you can send information. Number of countries have trialed using SMS. SMS doesn't use internet, it uses the mobile phone network. Send a message on SMS, it works. We can develop systems around SMS reporting. A number of countries funded by JICA, Japanese aid, have already introduced SMS reporting on key life-saving commodities like insulin, like ARVs. But Let me say this. The answer is not technology. The answer is you developing skills. That's number one. Computers will not solve our problems. You will solve the problem, and your skills mix will solve the problem. Computers, other items are tools that can assist us. They're not going to do it. It's human resources and people that are going to do it. Most supply chain data at central level is hidden by governments. How have others worked with governments when supply chain data becomes political? We come back to this aggregated data. If the data is aggregated, normally it's no longer secret. It can go in the public domain. So I think the key there is to aggregate data, to understand the key role of data management is sharing data, how to share data and maintain security and confidentiality. And that's one of the key points around data management. It's a skill. It can be learned. How practical is the course for data management? Well, it's focused on data management for public health supply chain in low and middle income countries. If you want to work in America, it's not practical at all. For our countries, in low and middle income countries, for public health supply chain, it's a practical course. Yes, it will help develop the skills. Will not solve all your problems, will not convince your minister, will not convince Global Fund to give you a big grant, but it starts by developing your skills. Please, can you send me the reference on Sierra Leone? It's on the screen. The link is on the screen on the slide. You will get the slide deck. In low and middle income countries, how can lack of resources be overcome? By advocating. Most of your countries have got a Global Fund grant. How many of you have asked Global Fund for funding to improve data management? 7%. 93% of countries have never asked for any resources to improve data management. You've never asked for them. So if you want to improve resources, you start by asking for them. So it's a common problem on our courses with Empower. Everybody wants free courses. The message we get from the donors is none of the students are asking for them. They're asking us for free courses. They're not asking the donors. So my message is go ask the donors, go and bang on their door every day, ask for skills development and resources for data management. Can you come up to train majorly on health data management? That's different. Health data management is different to supply chain data management. We do have a separate course for that on Empower. If you look on the Empower website, you'll find a course on health data management that is separate. Digitization in the health field. What are the opportunities to leverage generative AI for data analysis and management? In the public sector, right now, I would say 0. 98% of what is claimed to be AI is not. It's utter rubbish. 2 algorithms is not artificial intelligence. So much total bunkum and rubbish is talked about AI. AI has the potential to greatly improve matters, but not yet. It's not here yet. 98% of claims for artificial intelligence are lies. So understand, AI will have an impact in the future, not yet. Okay, I see I have a few minutes left, so okay, let's see if I can find some more questions. Challenge is integrating all of these data. Yes, it's a challenge. The first challenge is data standard. Now, many of your countries have published a data standard. Have you ever seen it? Have you ever looked for it? So in your country, look for the data standard. And then every time you introduce something, conform to that standard. How are you processing the data? Just typical. What is the barcode on the medicines you're buying? Have you ever specified the data standard for the barcode on the medicines you're buying? Is it in your tender contracts? Less than 5% of countries have ever done that. There are different systems of barcoding. Which one is correct for your country? Your country needs to decide. And many of your countries have decided, but you're not aware of it. It's published under different sections. It's not in the health department. So looking at data standards, that can help collate information, help get information to talk to each other so that we can collect it together. I see we've got 2 raised hands. Let's try Jacob Katumo first, please, if you'd like to unmute and ask your question. Jacob, can you unmute and ask your question? Okay, we'll try Mohammed Haibi then. Mohammed Haibi, can you unmute and ask your question? Mohammed Haibi, can you unmute? No? Okay. I have got Opami Adewala. Can you unmute and ask your question?
Yeah, good morning, Prof.
Yes,
thank you for that beautiful presentation. Thank you for the beautiful presentation. I have 2 concerns with respect to what you have enlightened us with. Number 1, on the issue of asking question about how to get resources for data management and development of skills. Those area they are more or less like not actually explored, especially at the low, middle, and income country. The number 2 thing is on the issue of data manipulation. Like you rightly pointed out, the data is I see data as a power that solves any problem, no matter what you are talking about. But it's like it's being manipulated. It's either some people don't want to use it for control, not really for the collective development. I want you to just speak to that, please. Thank you.
Okay, I'll take manipulation first. We recommend that by following the country standard on data, and that's nearly always ISO. So ISO as a standard on how you can process data, how it has to be collected, put together to avoid manipulation. So yes, that requires ethical behavior in data management. It's a key point. And the guideline we normally use for that ethical behavior is ISO. On resources, again, it's asking for resources, asking the donors for resources for data management. Everyone asks money for medicines. Nobody asks money for data management. And that has got to change. We've got to start asking for supply chain development, supply chain strengthening. Okay, I think we've just got a few minutes, so I'll try one more question. Malenga Lawesa, can you unmute and ask your question?
Hi, colleagues. I hope you can hear me.
We can. Go ahead, please.
Fantastic presentation. And I see that I got a lot of colleagues that I know on the program. I wanted to point out one thing on 14. In 2014, South Sudan on the supply chain for HIV, TB, and malaria products, we did not have any data at all to start with. So our idea was to approach the WHO, UNICEF, the other NGOs that were already operating in South Sudan to see if we could capture the number of people that were on HIV and
You still with us? I think we've lost you there.
from that, we used South Sudan. You know, it was coming out of the war.
Yep.
So they did not have data on the people with HIV, TB, and malaria. So what we did, we engaged the WHO, who are always there. I don't know why they are always there. UNICEF and various NGOs that were dealing with in these matters. So we came together and extracted some of that data as our start point. And then we used the GPS be able to locate the facilities that we are going to be dealing with, plus the anticipated return of the refugees. So the GPS and the barcoding helped us quite a lot in the running of the project. So we're able to refine the data accurately to the point that the people that we borrowed the data from started coming to us for the data. So thank you so much for this presentation. I really enjoy it. I worked for MSH as well as you did previously
Yes.
in Namibia.
Yes, indeed. Okay. Thank you very much for that. That's useful to know that you started with proxy data and then collected data and improved. Okay, I'll try and take one more question. Yep. Itari Imodia. Yeah. Can you unmute and ask your question? My apologies for poor pronunciation. Itarira Imodia.
All right.
Yes.
Good morning, Prof.
Greetings, greetings.
Greetings. Thank you for this awesome presentation. So my question is on the proxy data. We talked about the proxy data, that if a
Yeah, we seem to have lost you. Can you try again? The question was on proxy data.
country does not have data at a particular timing, like that. So me, I'm like, the proxy data, we really
Seem to have lost you completely. Okay, I try again. I'll try Gloria Leila B. Miller. Gloria, if you would like to unmute and ask your question, please. Gloria B. Miller, yeah.
Okay. Good morning, Prof. Thank you. Thank you for your presentation. I already posted my question, but looks like you didn't notice. But my question was concerning real-time data reporting. I think that it is very feasible to have data reported on real time, to have developed such systems. But now it might depend on the political will and priorities that we have. From your experience, can you tell us the feasibility and the challenge, and if it is also possible for data sharing, not only within countries, but between countries? Is that feasible? Is that possible? And what are the possible challenges that we can have with data sharing when we are developing systems for real-time reporting? Thank you, Prof. That's my question.
Okay, take it in two parts. Real-time reporting, absolutely it's possible. 80% of the private sector already does it. All it requires is the commitment and the funding. It can be done. If you look how much the private sector has spent on training staff in data management, you see the rewards that come forward from it. But real time is entirely feasible. The problem we have is getting the commitment and the resources to make it happen. Data sharing in low and middle income countries is a problem. Your country almost certainly has a data policy because the majority of countries in the world do. Most of these in low and middle income countries prevent data sharing outside the country. Doesn't allow it. It's a problem even if we want to share to the cloud. If we want to do a backup of our supply chain data, let's say to Dropbox or to Google Cloud, we might not be able to because our national data policy restricts it. In the high-income countries, they have more flexible policies, but the majority of low and middle-income countries restrict what data we can share outside the country. However, there is lots of proxy data available from the high-income countries which we can use to start with because their policies are more flexible. But you do need to be aware of your national data policy, and most countries have them, and the majority of supply chain staff are not aware about it at all. I've got a question there. Who is the rightful owner of the data? That's one of the problems that's established in the national data policy. Who owns the data? And it comes down from there. So high-income countries are into all sorts of debates about the patients own the data. Most low and middle-income countries, it just says the government owns the data. So we do have to be careful about sharing data between countries because of national policies, but plenty of proxy data available from the high-income countries if we need it. I see I'm out of time, so I have to stop now. Sonia, back to you to close out, please.
Thank you, Professor Andy. And I can see that you have already answered a lot of the questions, and I can see there are a few. If you have any other question, you can send an email to us, and we will try to answer that with the help of Professor Andy knowledge. So now I'll just move on to other slides. There are a few courses, information on the courses that Empower School of Health offer or will be launching soon or recently launched. So we have 3 courses on PGD. Yeah, so this is postgraduate diploma in global health procurement supply chain. Then recently we have launched postgraduate diploma in digital health, and soon we'll be launching postgraduate diploma in data management in public health procurement and supply chain. But for this course, if you are interested, because I can see there are lots of interest about the topic. So if you would like to go and check about the course, please visit our website. It is there. Currently, we are taking just pre-enrollments. Once the session is started, we will launch the course. We will accordingly connect you, and the relevant team will connect you all. In addition, there are a few certificate courses on the bottom. You can see these are the courses. You can visit the website for the complete list of courses. And we also have long-term courses also, Masters of Science in Global Health and Procurement Supply Chain. That is for 24 months, 12 months. Again, the information, and these are the few short courses that is available on the website. The link has been posted on the chat box of the website, and you can check over there. Also, we have few partial scholarship for each of the courses. So as soon as we receive the application, it will be provided first come, first serve basis. So please visit the website, fill up your form, and relevant team will get connected with you. We have partial scholarship that is depending on your submission. So please connect with us on the same. Now this is a time to launch poll 2. I would request backend team to please poll launch 2, and I request all attendees to please participate in the last poll. Also, there is an upcoming webinar that is scheduled tomorrow on different topics. So please visit our social media platform to know about all the upcoming webinars. So I can see poll 2 has already been launched. So there are very basic questions. Those are there. What was this information useful? Are you interested in exploring digital health? It should be data management course. Which course and training are you interested in? I can see there is lots of interest on data management. So which I have just mentioned, we will be launching this course on this particular topic. So you can visit the website, fill up your application form, and you can also be eligible for the partial scholarships. Then which type of courses, training are you interested in? I can see the people are interested for long-term courses, basically, that is PGD and Masters. So we have all of the list of the courses that is available on the website, and link has already been posted on the chat box. And I can see there are a few questions about the slide deck. I'm so sorry that we would not be able to share the slide decks due to compliance issues. But however, you can check the webinar recording that is available on YouTube and Facebook live page. Plus, the certificate of participation will be shared with all post-webinar within 24 to 48 hours. And for any other question, please connect us on our email ID that is mentioned on the website. So everything you can find out in the Power website. So I can see 41% of participation is there. Please request others to participate in the last poll, and then we will go ahead with the closing of the session. I'll just briefly explain. 99% of attendees says yes, the information is useful. Are you interested in exploring about the course? I can see 97%. Then 51% shown interest on data management in supply chain. And then I can see 32% shows interest in masters. Then 19% are showing for PGD, then diploma course, and 26% on certificate course. So we have all of type of courses. You can visit our website to check them. That's all. So we will be now ending the poll. Thank you all for your participation. And this will be the certificate of participation will look like. It will be sent to you all post webinar. Thank you all. Please visit our social media for upcoming webinars and session. Thank you, Professor Andy, for your valuable sharing with the attendees.